hypertension, and cognitive decline, a great challenge to clinicians. An overview at a glance. Let's review some of the clinical and pathological features. In late life, diastolic blood pressure tends to fall, while systolic blood pressure goes to a continuous elevation. Atherosclerotic plaques are developed in the cerebrovasculature as a consequence of hypertension, thus increasing the risk of ischemic stroke. High blood pressure is a risk factor for cognitive decline. Hypertension in midlife predicts cognitive decline in the elders. Worsened cognition, such as an intellectual decline, in hypertensive patients was formerly observed by Wilkie and Eisdorfer in 1971. Cumulative data suggests that hypertension is behind the neurodegenerative disorder related to Alzheimer's disease. What are the pathophysiology consequences? One of the most common damages observed in hypertension is the white matter lesions affecting cognition. Brain sectors related to cognitive function, such as basal ganglia and hippocampus, suffer from blood flow reduction. In hypertensive patients, some changes occur at the cerebral vasculature with consequences in cognitive function, such as microbleeds, lacunar infarcts, microinfarcts, brain atrophy. Approach to the patient. Regarding the hypertensive patient population, clinical evaluation should include cognitive status, particularly in the elderly. The most relevant impacts of hypertension on cognitive function are focused on motor speed, attention, executive function, or the updated therapeutic scenarios. A debate remains at present regarding the most appropriate antihypertensive treatment to prevent cognitive decline. Currently, angiotensin receptor blockers ARBs, calcium channel blockers CCBs, and thiazide-like diuretics seem to be better than others in reducing the evolution of cognitive decline. What are the expected outcomes? Recent data suggests that antihypertensive treatment reduced the risk of dementia by 13%. The ARBs, CCBs, and thiazide-like diuretics have shown lower cognitive impairment rates, -24%. In the PROGRESS study, perindopril demonstrated the following reduction rates: 12% for dementia and 19% for cognitive decline. In terms of therapeutic duration, with each additional year of antihypertensive treatment in patients age lower than 75 years old, dementia risk was reduced by 8%. Appropriate blood pressure control generates at least two beneficial consequences: attenuates the progression of brain lesions and reduces the decrease in general cognitive functioning. What lies ahead of us? Cognitive malfunctioning is nowadays one of the most critical healthcare challenges. Additional controlled trials are required to address clinical outcomes in evaluating different kinds of drugs to diminish the risk of cognitive decline. If antihypertensive drugs prevent cognitive impairment, is an unmet clinical issue. Currently, the hypertensive mechanisms involved in atherosclerosis development are poorly understood. Similarly, whether the association observed between hypertension and Alzheimer's disease is causative or incidental remains unclear. From an epidemiological point of view, the appropriate control of hypertension seems to be a pathway to diminish the global dementia burden. Do you think this is an important issue? If so, let me know your comments, share this content, or deliver your insights by writing.